Abilene.
On that larger scale, I know that a few weeks ago, there was some modeling in regards to what India experienced with the variant in projections, but any sort of modification just statewide or even regionally of what that may look like, or is that still pretty ambiguous in regards to?
So I was looking at some information yesterday, and they were looking at the rates or the velocity of increase in cases. And it looks like the velocity of increase right now actually exceeds what we experienced at the beginning of the year when it, really got at its worst. And so that's what everybody is bracing for, that it's kind of like a car, the faster it speeds up, you can anticipate that it's going to reach much higher speeds, or case rates if we don't do something to intervene. And as was mentioned yesterday, in our meeting, we know that there may not be a whole lot we can do right now because that trajectory is already happening. And if people suddenly get vaccinated today, it's going to take a good month or so to reach, fully vaccinated status where you can feel like they've got the immunities that they need to stave off any infection.
Now, who is Dr. Hellerstedt?
Dr. Hellerstedt is our Commissioner of Health for Texas.
And what did he say yesterday in regards to the 159% increase in cases? Did you watch the video?
Yes.
Did you talk about that?
Right. So I watched half the video and they got sidetracked. So yes, 159% increase in the number of cases, and I don't remember the time frame. Was it
was last 30
within
days.
the past month? So we've been looking at cases just in this since July 1st. We've gone from a positivity rate of around 1% to sometimes a little bit less than 1%. And as of this week, I think it was over 5%. Our hospitalization rate with the 15% capacity, as you'll remember, that was the governor's threshold in GA 32. And we went again from below 1% into now I think that rate in yesterday's chart was somewhere around 4%. So doesn't sound significant, but moving that quickly, we know that it can quickly rise. And we also know from the hospital previously that 15% is somewhat arbitrary. We're in trouble way before we hit 15% locally just because we have such limited resources with our ICU.
And that
beds.
early on, I remember maybe it was Mr. Holland, but they had kind of a matrix that looked at a number of infections translating into a number of those who get ill, a number of those who get in hospital, and it all the way through. And I'm just wondering, with the drop in age, is that modeling still accurate there, or do we know enough in this new cycle to even make that?
Yeah, I don't know that I would be able to answer that intelligently because I haven't seen anything that alters that. So I'm not sure.
And Mr. Hanna, to you, again, the one thing I know about COVID-19, a lot of folks just don't know. We just
You don't know until you know.
So if, with this projector we have now, have we missed it? Is it still worth having that incentive? I'm just trying to.
Yeah, it's a great question. One of the things we spent time talking about is that we probably likely missed the ability to do anything that's going to be meaningful for the Delta variant. But we saw a summer spike last year, and this is what Dr. Drachenberg talked about, our health authority, is that we saw a summer spike and a winter spike, and things we do now can help potentially the next spike that may come, or the next variant that may come. The rule of thumb is that we're not done with COVID, right? We may be done with it, but COVID's not done with us. I think Brad Holland said that in the past. And I think it's going to hold true, these different variants. We get better, we respond better over time. We understand the virus better over time, but it still has an impact. And right now, from a scientific basis, based on things I've read and what I'm seeing authorities issue, is that the vaccine is our best defense against COVID right now, and its various forms. And so the incentive will help our workforce weather the storm and allow us to make sure that we are providing essential services to the community. that was the intent of the incentive. In trying to figure out the number of employees that may not be vaccinated or may not have antibodies, in that memo I wrote to council, it kind of goes through a logical exercise of here's the vaccination rates in the community based off of serology. I'm going to say that wrong. It's a blood study that they looked at antibodies across the nation. In Texas, taking the average Texan that has antibodies from COVID in their system, which means they've had COVID before. You subtract that from our employee workforce or population, there's 500 so folks that potentially have not been vaccinated or have no antibodies to COVID. Well, that's our entire police and fire department. And civil and non-service personnel completely gone. Now, I know we have firefighters that have been vaccinated. I know we have police officers that have been vaccinated. So I'm just saying that from a comparison standpoint, it's a large part of the organization. Is there value in trying to incentivize that middle that haven't made up their minds yet? Maybe. It was asked that this be discussed by the council. We're bringing that forward for y'all. Annette and I clearly believe it is, otherwise it wouldn't have issued the administrative directive. I thought and think still it's probably in my purview as city manager to do this. Council's rules of procedure say that if a council member wants to talk about it, we put it on the agenda. So I have no problem discussing it. And if council wants to make it an issue that they talk about, it's perfectly appropriate. So that's why we're here today.
And then we'll have you here, and so I'll turn things over to Shane. So I want to say, as a county, are we at around 32% fully vaccinated? And
So we lag
37%.
behind both the state and the nation in terms of our vaccination rate here in Taylor County. I think it was I don't have my page in front of me. Was it 34%, 33%?
Memo
I
says
remember.
38.8.
38%.
38 point,
At least have just
2%, I
one
think.
shot at 30%.
Correct. Or no, that's fully vaccinated.
That's
vaccinated?
fully vaccinated. So the ones who are 12 and older who are
38.8.
eligible, it was 38.8, whereas Texas and the nation are at around 50%, if not a little bit over. And so we lag significantly behind vaccination rates.
We do anything different in regards to making it more convenient, easier, anything we're trying in regards to partnering with others in the community that will help us get more shots in arms?
We talked about that yesterday during our call, and we're going to work with the universities and other large employers to try to do some drive-through clinic opportunities. We're going to make sure that the pediatricians in town know how to sign up to be able to administer the vaccine if they choose to for their patients, and their patients decide to get it. So there's some things we're still working through to make sure accessibility is easy for the vaccine. Really, the easy part of the vaccination program is over. If you wanted a vaccine, you've gotten a vaccine. Now there may be a hindrance for or slowness to get a vaccine just because of accessibility. You don't know where to go. It's not convenient for you to stop your day to go get it. So we're going to try to increase our ability to meet people where they're at, provide a vaccine to them. You saw the Texas Department of Emergency Management do a pop-up clinic at the airport where they were offering shots for people getting off airplanes and people getting on airplanes. So I don't know how effective they were, but you see the state of Texas doing the same sort of, how do we change the model of administering vaccines? Because those that want it and are going to stop their day to get it have already done that.
Well,
And you can get it when you're at Sam's or the grocery store, so.
To Kyle's point that he raised with what you described as there's a segment of the city employee population that one way or the other is fine, they just haven't done it, and an incentive might switch them to do that. If we only give the incentive to those who haven't had it, my guess is there's a fair number of people that got it that were just as blasé, they just happened to get it. And if we see this as there's been news reports that there might be a booster shot needed, having an incentive that rewards you for waiting may encourage that portion of our employee base to go, if I hold off, I might get something good. You know, we weren't talking about an incentive a month ago, much less 6 months ago or last year when we were having these surges. And so there might be another surge where even though we think today this is the one and only thing that we'll do, that it's bad enough that we go, we need to do something. And so I'm concerned that having a limited incentive might hurt future need for having vaccinations.
And I have heard that argument. I think there's a segment of the population who perceives themselves to be high risk. They have chronic health conditions, and so we'll get those people. Honestly, from a fairness standpoint, if we had had the money earlier, it would have been great to offer some sort of incentive program. And we can look at things like doing something like Hendrick is doing, where they're offering reductions on their employee health insurance plan in order to get it. They've offered like a day off. The day you get your shot, you also get your 8 hours PTO, things like that. So it's not that we're not against giving it to everybody in a fair way. It's just, here we are. We can't go back in time. We can't make the money be allowable for other things that we want to use it for. I told Mr. Hanna, well, I'm the first one. I'm also an employee. I also got vaccinated prior to an incentive program. So, my employee perspective is, hey, that's not fair. What are you going to do for me? But in a public health official role, this is going to benefit the community. I have to put that aside and say, what can we do right now? It's a hard decision. It may not be a popular decision, but does it move the needle significantly on getting more people vaccinated? Yes. And therefore, as a public health official, that's what I would strongly recommend.
And I'll just say that it was my decision in putting the program together. I made the decision because I was trying to be as budget neutral as we possibly could be, and to make sure whatever we did do was funded through federal dollars versus Abilene taxpayer dollars, which is why we did not do PTO for people who've already received the vaccine. If that's council's pleasure, I have no objection for me. I also was one of the early adopters, right? I got my vaccine as soon as I could, so I wouldn't have been eligible for the program anyways. If you look at doing that, and this is something that council wants to offer, a lottery mechanism is probably the most effective way of doing that, and also the most cost-effective way of doing that. Is you got your vaccine, you get to spin the wheel, and here's what you get. If you land on the prize, so to speak. So that can be something that we consider if council wants to head in that direction.
Anyone else want to speak on this subject from council?
I have a question. So, I think I agree. I think an incentive is a good thing. But the only thing is not just rewarding people who have delayed behavior for trying to get the vaccine, but maybe there's people who have disabilities who can't get the vaccine. Maybe there's people who have religious beliefs that hinder them from getting the vaccine. So, what would you do to maybe safeguard against that? I think there's ways to incentivize other than getting the vaccine. Is it more COVID testing? Like, have you thought through possible options for people that for them, that isn't even an option, and you can incentivize them in a different way to possibly?
So for people with mobility issues, we've been going out. We send a team out to do home vaccinations. So through Meals on Wheels is who we've done it mostly through, since those people are homebound.
Sure.
We send out a team at least once a week as more people sign up and get on board. So that's definitely something that we're able to do. As far as people who are unable to get vaccine or get the vaccine for whatever reasons, I think that this is for them too. Getting other people vaccinated is for those people that you have people who don't react to vaccines. They don't produce antibodies like you want them to do when they get a vaccine for whatever reason. So this protection is for them. I'm not sure if there's some other thing we can give them other than protecting them by getting the people around them vaccinated. But we've offered to go on site anywhere.
Because I was just thinking about your city employees, like, if they opt to not do it, can they do more testing? Can they work remotely? Like, if you're trying to incentivize safety.
We provide free testing to employees.
We do provide free testing to employees, and in certain cases, we approve remote work. But it is not something I've authorized en masse for people to use because there's work performance issues associated with it, unfortunately. And some jobs can't work remotely. It's hard to be a groundskeeper, do that remotely, right?
Mr. Hurt, Councilman Hurt.
Well, thank you. See that we are going to talk about the incentive program. I didn't know we were talking about hospital beds and 159% increase, but what was that number compared to last year? Not percentages. What was the number? 22 people, and 2 weeks ago there were 22 people in the hospital. 4 of those were vaccinated. 34 now, 2 are vaccinated. And this vacation days incentive is paid for ARPA funds, but what are we talking about loss of revenue for lack of production for all this vacation time? I'm a businessman. I can't afford to give every employee a week's vacation. And looking at it from the business standpoint, that lost production, if it's that easily made up, I mean, as a business person, we're shorthanded, but it makes it look like we have too many people. If it's that easy to cover that many vacations for that many people in 1 year's time or in this short amount of time, I'm not for it.
The intent wasn't to indicate that that we're overstaffed in any way. The intent was to provide an incentive that was meaningful, that would get people to move, and so we chose 40 hours. We didn't think